Parents of children with congenital microtia often have a mindset that they hope the surgery has minimal cost, minimal trauma, and yet still yields great results. In reality, this is impossible. You need to understand a basic principle. If you want to make a nice, larger piece of clothing, you can't do it with just a tiny piece of fabric. You might make something, but it won't be a good-looking piece. So, patients must have proper indications for surgery. Recently, we have seen a certain type of surgery, auricular expansion surgery. This technique is quite old and has been around for a long time. There are some small techniques involved, but it's not that complicated. However, I've observed that some doctors have broadened the indications too much. Some children with very small ears have undergone expansion surgery, but the final results were still unsatisfactory. Ultimately, they had to come to us for ear reconstruction. So, the previous surgery wasn't necessary, but it was performed anyway. And after the surgery, there were scars that impacted the subsequent results. Only those with relatively minor differences between the ears can benefit from surgery to adjust the size. Alternatively, the good ear on the opposite side could be slightly reduced, or part of it could be moved to the ear with a deformity. I even know of some doctors abroad who reduce the opposite ear a bit, or even narrow the ear groove on the opposite side. Then the skin on the affected side can be adjusted. However, this method typically cannot solve the problem of microtia. Auricular expansion surgery is more suitable for surgeries on ears of similar size, or cup-shaped ears. So we hope that doctors strictly control the indications for this procedure.